Thank you for joining from all parts of the country. East to West, welcome. We've got our interns just coming back from a break, and you are the last panel of our 3-day boot camp where we've heard from a lot of folks. So what we'd love to do is just start off with, this is the title of today's session, is Pivots in Healthcare, Business and Public Health Responses in the Time of COVID. So we'd love to hear from you a little bit about your professional background, your career background, and then we'd love to talk to you about what were some of the things that you worked on in the time of COVID, maybe even start talking about what do you think lies ahead. So with that, let's start with, love to hear about your background. Chelsea, hello, good to see you. Would you like to start and tell us?
Yeah, sure. Hi, everyone. Great to see and meet you all. And thanks so much, Anita, for the opportunity to join you today. So my name is Chelsea Harris, and I lead the competitive intelligence function for Gilead, focused on HIV and emerging viruses, which as of early last year expanded to include COVID-19. I've been in this role for about 2 years. I joined Gilead in 2019, immediately after I completed a joint master's in business administration and master's in public health degree at UC Berkeley. And I'll just go back a little bit before that and talk through the journey that I took to get to where I am today, very briefly. But I've been pretty clear on wanting to work in the health space, and specifically the global health space, since graduating from college in 2011. I spent 4 years immediately after undergrad working at a consulting firm that specialized in global health advocacy and resource mobilization. And I worked very closely with a wide variety of clients, pharmaceutical companies working in the global health space, large foundations like the Bill and Melinda Gates Foundation, and then smaller nonprofits. I knew I wanted to be in the space long term, and I think it's really important to understand how decisions at sort of the macro level are playing out in country. And so I transitioned after that to a role with a branch of the Clinton Foundation, where I was working based in Haiti with the Ministry of Health on malaria elimination initiatives. And it was really there that I kind of crystallized, I think, what I want my long-term career to be focused on, which is effectively engaging the private sector in global health and increasing health equity in low and middle income markets. That is what really motivated me to pursue the joint MBA and PhD degree at Berkeley. And I knew that I wanted to spend some time after grad school working in the private sector, both to learn best practices that I think the private sector and industry have to bring to the public health nonprofit space, and also to continue working on disease areas that I'm passionate about. And so I'm fortunate enough to be working on HIV, as well as COVID, both diseases that have massive global impacts. And so it's been a really exciting role. I have learned a lot, now lead a team of 2 focusing on the therapeutic areas I've mentioned, and am excited to share what the experience of working through COVID has been like at Gilead and the rest of the conversation.
Awesome. Thank you, Chelsea. And I'll pass it to Yusyin.
Good morning or good afternoon to everyone. So my name is Yusyin Hsin. I am a project officer within the Bureau of HIV at the Division of Disease Control here at the New York City Department of Health and Mental Hygiene. And my role is to be a community partner to be the representative, but a partner for the community on one of the largest HIV testing initiatives in the country. You know, the idea that we want all of New Yorkers to learn their HIV status, take advantage of care and prevention resources, and honestly, to really help and support and engage the partners, the healthcare facilities, the community-based organizations, faith-based organizations that are working in the community, that are trusted partners for individuals to support them in making sure that we sort of end the epidemic of HIV in this country and across the world. Another part of my tasks are to support community building, capacity building contracts to sort of help transgender-led organizations who are also one of the largest heavily impacted communities infected by HIV, and also just sort of help collect data and support programming activities for the health department to move forward. I'm fairly new to the health department. I've only been here about 2 years. I joined in about 2019. Prior to that, I came from a year of doing a year of service through NYC Service or AmeriCorps program called NYC Civic Corp, and I was placed at the Office of Emergency Management. I graduated in 2017 from Columbia University Mailman School of Public Health, focusing on health policy and management. And then I started my career in life after undergrad at a nonprofit here in the city called Vibrant Emotional Health, which is a direct service, advocacy, and policy nonprofit. And there I was working on a children-focused mental health program called CCSI, Coordinated Children's Service Initiative, that just because a child is at risk of mental health illness or developing mental health issues, that doesn't mean that that's the only issue. It also has issues of upbringing, social determinants of health, education, all of those touches that impact a child. We want to think about how to bring them all to the table to solve it collaboratively. So anyway, that's a little bit about me.
Awesome. Thank you. And over to Jordan.
I don't know how I'm supposed to follow those two wonderful introductions. Hey everyone, I'm Jordan. It's great to meet you all. And I'm hailing from the West Coast here in Oakland. And I work for a company called Vault Health. Vault Health is a digital population health company that the thesis is to provide health in people's homes. And so we do provide a variety of services. And we'll talk about this later, but obviously COVID for us changed dramatically. And now we do lots of vaccinations and at-home testing, et cetera. My background is always been healthcare. I was a pre-med person, wanted to be a doctor, and decided once I saw how much time we would have to be in school and how much money it might cost, I said, why not? I'm not gonna do that. And so I've been in healthcare on the business side for 10 years, started in finance type stuff and strategy work, working for a company called United Health Group. And then for the past 6-7 years have run large medical groups. So before joining Vault, I was a COO of a group that had about 500 doctors. So really excited to be with you guys and talk about, hopefully share some experience that could be helpful.
Awesome. Thank you, Jordan. Who else out there is formerly pre-med? Any hands? Or maybe there are current pre-meds. That's okay too. We like everyone here. Great. Well, Jordan, maybe we'll start with you. Can you tell us a little bit about what was some of that work that you did with respect to COVID in the past 6 months, year?
Sure. So like I said, Vault Health was basically a digital healthcare company that originally started with focus on men and providing treatment to men with a variety of diagnoses. But COVID presented a unique opportunity because, as everyone knows, you couldn't go to a traditional clinic for a lot of things. And so we rapidly met some needs for state governments and organizations to provide testing. And so obviously, I think everyone here probably has been tested numerous times. And so our PCR test was a saliva-based test. So we partnered with a lab very early on through Rutgers and then brought to market at-home saliva-based tests. We've done 5-6 million tests now year to date, and really pivoted our entire organization to go from what we were doing to support testing. And we so that as you can imagine was a complete strategy business shift all in the course of about 2 or 3 weekends. And so it has been a very exciting year for our organization as we've tried to at least provide our part for public health.
Wow. So men's health to at-home care to saliva-based testing, which there's an organization that we heard a little bit about last night here in New York that does also some testing, Miramis. Not sure if you're familiar. Yeah, great. Chelsea, can you tell us about the kind of work that you've been doing at Gilead?
Yeah, sure. So Gilead actually got involved in COVID-19 basically in less than a month after the first case was identified in China. And the reason that we got involved so early on was because we had a drug in our library. Gilead was established as an antiviral company and has since evolved to explore other therapeutic areas, including oncology, but we still have a really, really strong foundation in the antiviral space. And there was a drug in our library called remdesivir that actually began its life back in 2009, and it was a potential treatment for hepatitis C. Didn't work out quite as well as everyone had hoped. It got sort of a second chance at life when we started to see some Ebola outbreaks in the Congo a number of years ago, and wasn't particularly effective there. But when COVID became a thing in late December of 2019 or early 2020, Gilead had remdesivir already well evaluated in the pipeline, and it had demonstrated antiviral activity against a variety of coronaviruses. And so we very quickly were able to move that drug into phase 3 trials because we had had so much development. We knew its safety profile well before COVID came onto the scene. The specific projects that I've been working on since then, very early on, there was essentially sort of an all hands on deck mentality at Gilead. As a pharmaceutical company, there was a lot of pressure and eyes on Gilead to try to bring a therapy to market and address, the pandemic crisis that was unfolding. So I was pulled on to sort of an emergency response team where I was involved in essentially taking our raw clinical trial data that was coming in and putting that into presentations and meeting materials that our leadership was having with the FDA and EMA regulatory bodies for conversations about access to our drug. As an early part of the pandemic, I also worked on management of the intake process for hospitals that were requesting early access to our drug before there was a formal emergency use authorization or full regulatory approval. And then more recently, now that we're slightly out of the immediate crisis mode, I've been back in my more traditional role working in competitive intelligence, and I've been building out sort of a dedicated full-time CI support team for COVID-19 because Gilead views this as an area that we need to continue to invest in. And as part of that, I've been involved in a variety of work streams really focused on the development gating for our outpatient therapies and how we think through go, no-go decisions about what we move into different stages of development to hopefully help patients in the longer term as COVID is likely to remain endemic.
Wow, great, thank you. Yesterday, we learned a little bit about drug development. We heard about intellectual property and drug development today. So hopefully some of the terms that Chelsea was using are starting to sound a little bit more familiar to everybody in the audience as well. Yushin, am I getting it right? I feel like you told me it was like ocean, but
yeah, ocean with a Y. So Yushin, ocean, you got it.
Thank you.
Listen, the health department, nothing. There's no change. Like, COVID happened. No, the moment we heard about the first case that was happening, reported in China, the city started opening, here at the health department, we started opening up a small team to start exploring, is this going to be a potential issue? Once we had the first confirmed case last March, the entire city agency just sort of goes into an emergency response. And what we activate what is known sort of as an incident command structure. It comes from emergency management idea, but individual staff is ripped from their day-to-day role to work on special emergency response groups. For example, as you kind of understand from a city response, we were talking about people, well, how do the labs handle it? How does environmental operations happen? How do healthcare facilities respond? And how about long-term care and retirement homes? And how do we manage all of this? And people are pulled based on their skills to kind of work on these. I was pulled onto a team for surveillance and epidemiology. The idea that we just want to find out How do we do clinical operations? How do we handle sort of some of the risk assessments and communicating, and how does the mental health aspect of things go? For that, I was rolled as sort of what's called a desk officer, which is there's a dedicated email address. Hundreds of people are trying to get resources and figure out what are the things they need to do the coordination, the collecting, the analysis of data. A new challenge from COVID that we learned was work from home. There was no sort of teleworking protocol. And how do we get people who are leaving literally last minute with a laptop and being able to do their work safely at home in that time? Also, I was pulled onto tasks of being an API engagement coordinator based on community partnerships, because the virus had a lot of impact on perception on the Asian communities in New York City. So how do we partner at the health department in helping them get their needs heard? How do we coordinate with other city agencies to better improve the kind of these response specific objectives for these target communities? In the last half a year, I've been pulled onto what is known as a public health surveillance activity. It's labeled under the IRB, which is, we know what cases are of COVID in New York City. We know when it happens in the hospitals, but we don't know what it really is like on a population base level. And so we wanted to determine what is the extent of the infection from COVID? What is the seropositivity of all New Yorkers? Collecting blood specimens from volunteers to sort of map out what would be the seropositivity of New York City at certain points of time based on a sample size of maybe 1,000 plus, and then weighing it for the entire city. So that is we're currently in phase 3 of that. And we're able to kind of see what things were like last summer, last fall, winter, and what's going to look like now in spring, now that vaccination has come into fruition.
Well, thank you all for your work. And Yushin, I even was visited by a contact tracer at some point because I was honest on my LaGuardia form saying that I had been out of state. And then they came knocking at my door wanting to make sure that I hadn't left. I'm not going to answer whether I did or did not, but the system seems to work.
Thank you. And contact tracing was also something that really had to be mobilized rather quickly in this response, especially from teleworking. So always thankful.
I'm not sure if there were any interns out there who got involved in contact tracing efforts. So I've somehow just lost you all on my screen. I don't actually know how that happened. Well, I can't see you right now. It's a little embarrassing, but nor can I, well, I can see my questions. So
we can hear you, so you can keep going.
Great, thank you. So we started already talking about this a little bit, but how did COVID-19 change the kind of work that you would normally do, both the content as well as the way in which you do your work? So maybe we'll start with Yushin, because you started even talking about just that work from home, telehealth, or sorry, just working remotely without laptops. Could you start?
Yeah, as you imagine, the moment that COVID hit the city, everyone was sent home to work from home safely, right? And so that really has a huge impact on a large part of what I do, which is making sure New Yorkers know their status by getting an HIV test. And so pausing those activities, supporting our partners in figuring out, okay, now that we're no longer able to test individuals, how do we get HIV tests to people? Can you become a community health test center where people can contact you, get a test kit, and able to do a test and send it to a lab to know your status safely and conveniently. Also low cost or free, preferably. Certainly also trying to figure out as our team on how do we fill the gaps of this temporary hiatus that we didn't really know what was going on. So we kind of flexed into using Zoom, the new buzz technology, right? Of how do we do webinars and informational sessions that are going to tackle the topics that our partners need. So, for example, with the early days of high mortality due to COVID, how do you cope with grief? How do you talk to your staff and your clients about grief? Also, how to have fun during quarantine. How do you do employment in the age of COVID, or last fall when
There
we're
was fun in the time of quarantine? I'm sorry.
right? Like,
Rewind.
how do you balance remote learning for your kids in your one-bedroom apartment in New York City during quarantine, but still keeping them engaged and active? So certainly that kind of activity. How do we deal with COVID-19 and racism? Because equity and racism was a big topic in New York City and across the country last year in 2020. And then certainly with digital technology of telehealth, how do partners start rolling out a telehealth program within their organizations? And I'll just plug in one more really wonderful tool, was that Monday.com and Slack started becoming a tool that the city was investing in. That was something that, there was always hesitation about, because that was a better way of communicating with your team members or sharing documents that is much easier than emailing something, fixing it, and hoping that no one corrects the email that happened before your corrections came in, all of that. So lots of learning that happened last year.
I love it. NYC government embraces Slack. That's awesome. Cool. Well, you did mention telehealth, so let's pass it to Jordan.
Yeah. So I think when COVID hit, and I don't think this would be too dissimilar for most organizations, but like the way I see it is our organization had to respond like any other organization. Like, how do we move our operations from being downtown New York to people's homes? And that was a tech solve that, I applaud our IT teams for figuring out very quickly. And probably like during that same time, I told you guys that we actually pivot our strategy as an organization. And so how do you remotely from the living rooms or bedrooms of people's homes organize a complete organization strategy shift, make sure that people are on board, engaged, make sure that the science and our lab partners are all connected. And so like that was, a very fun challenge for us to do. And I think the key thing we did consistently is communication, but be really effective in your communication. And like that, I think that's the most salient thing I've learned is, you lose out on some